I'm incredibly thankful and about my experience with green imaging. I kind of have two experiences. One, I want to kind of it's my own personal experience where I was having severe abdominal pain and really could not get into my primary care provider for, assessment and referral. I actually went to an urgent care center that I thought would, kind of as a last resort. And even there, I was going to have to wait, several hours. And so even though I was really in intractable pain, I literally just went home and crawled into bed with just very, very uncomfortable. And so what was interesting to me was, although I'm in healthcare and I am insured, I really was at a loss for getting the kind of appropriate guidance, even was as a kind of an insider into medicine. And, fortunately, I had met Dr. Dickerson a few months prior. And so I did reach out to her to see if I could, get some imaging for my abdomen. And I really felt the most care I had ever felt, maybe outside of the military healthcare system, to where not only did I have quick and kind of concierge type of experience, but her whole team made sure that, I was taken care of and then quickly had the results. And so in many ways, I think those who aren't in healthcare are going to be even feel more lost in the system. And we do hear about overutilization of the emergency room. I probably should have gone to the emergency room based on kind of how things unfolded later on. But, me being aware of kind of overutilization or abuse of the emergency rooms for kind of the inappropriate reasons, that was kind of in the back of my mind. But I think what really resonated with me was, even though I was well insured, I was kind of not able to get appropriate access to care in a timely fashion. And so having relationships with networks and providers that are kind of from a more transparent and direct relationship is absolutely critical. And I think that that's part of the problem. If people feel like they do not have a partner in their healthcare, then they're going to just go to the ER, and obviously they do share some of the burden, but the employer also will actually experience a lot of that cost as well, especially if it's not needed appropriately. And so, my personal experience, although it's an anecdote, absolutely, I think, is the common experience for many people when they're in an acute medical issue. And then I also think about it from a chronic medical condition. And I think that's where direct primary care really can make a big difference. We haven't spoken necessarily about that here, but I think a lot of primary care doctors in the traditional health insurance model have to see a certain amount of patients per hour for various reasons. And so it's hard to build a rapport with that primary care provider in a very short time period. And so I think really the direct engagement with healthcare providers, whether it being primary care, imaging, and then also I think the other big spend is pharmacy benefit. But there really needs to be a paradigm shift in healthcare provisions to where you have more of a direct model. Just like if you were going to buy anything else in your life, you would know the cost, see the value, and decide to purchase it or not. So, Dr. Dickerson, I don't know if I didn't have really my head screwed on very well back then, but I don't know if this is commonplace for you and your team and your network, or if I just happen to remember our relationship and kind of engage you on a kind of emergent basis. So I don't know. I never got to ask you if that's more common or not. So
now, we really consider ourselves providing direct radiology services. We think the radiologist should be around. My background is with multi-specialty groups, and the multi-specialty groups I worked with paid more to have in-house radiologists that they could come down and look at images with. They saw that much value in being able to discuss the cases with, and they would even bring the patients into the reading room and say, he hurts right here. What do you see? And that's better care. And so we are very actively involved in our practice. When orders come across in our referral management system, we're actually reviewing the